Hello and welcome to the daily coronavirus update live from Fox. I'm Claudine Wong. If you are just now joining us for the first time, thanks for being here. If you've joined us every weekday, we certainly are glad to see you. We are live streaming every weekday on coronavirus.com, also streaming on Facebook pages across the nation. That's a place where you can comment. We will see those comments, and so you can interact with us here. So we always love to see that. Our broadcast always starts around 10 a.m. Pacific, 1 p.m. Eastern time, and we bring you the very latest on everything that's happening with the coronavirus across the nation and the world. So this is a great place to be. We like to start out with the latest numbers because we want to give you a look at where this is ever changing around the country. And when we talk about the latest cases, Fox has been tracking those numbers. So when you talk about total number of cases, the United States has now more than 9,300. And the hardest hit states you see there in those darker colors, you've got New York with 4,152 cases, Washington with 1,187. and California with 870. Massachusetts and New Jersey follow behind, but by hundreds of cases. So we certainly are seeing the three states, New York, Washington, California, being hit the hardest. When you talk about the number of deaths, that number right now is at 150. Now, the president did have a press conference this morning at the White House. That briefing actually only ended about 15 minutes ago. He spoke for about an hour and 45 minutes, hitting a lot of subjects from economic stimulus to medicines, vaccines, potential treatments. Let's listen into what he had to say.
As you know, my administration is working every day to protect American people and the American economy from the virus. Yesterday, I signed into law a critical support for American workers, families, and small businesses. It's a big thing. We're providing sick leave and family medical leave to those affected by the virus, and more help is on the way as we speak. Our entire team, headed by Secretary Mnuchin, is on the Hill. We're working with Democrats and Republicans, and there's a lot of goodwill going on. This was something that happened that was, some people would say, an act of God. I don't view it as an act of God. I would view it as something that just surprised the whole world. And if people would have known about it, it could have been stopped in place. It could have been stopped right where it came from, China. If we would have known about it, if they would have known about it. But now the whole world almost is inflicted with this horrible virus, and it's too bad. It's too bad because we never had an economy as good as the economy we had just a few weeks ago. But we'll be back, and I actually think we'll be back stronger than ever before because we learned a lot during this period of time. I also just invoked the Defense Production Act to help facilitate distribution of essential supplies if necessary. We're working with Congress to provide major additional relief to the workers, small businesses, and the hardest hit industries. We want to make sure that everybody is able to continue on so that when we recover, all of these companies and these great businesses, both very, very small and very, very large, are not going to be broken up, and you'd have to put them back together. That would take a long time because we really believe in, I believe in the V curve. I believe it's going to go, when this is defeated, this hidden scourge is defeated, I think we're going to go up very rapidly, our economy, and get back to where it was and beyond. Today, I want to share with you exciting progress that the FDA is making with the private sector as we slash red tape like nobody has ever done it before. Somebody was on yesterday on one of the networks and said that there's never been a president even close that's been able to do what I've done in slashing all of the red tape and everything to get very important things to the market, medical. So we slash red tape to develop vaccines and therapies as fast as it can possibly be done, long before anybody else was even thinking about doing this. And as you know, earlier this week, we began the first clinical trial of a vaccine candidate for the virus, and that was launched in record time. It was just a few weeks, and that would have taken years to do, not so long ago. As we race to develop a vaccine, we're also pursuing antiviral therapies, and that's what really we're going to be talking to you about today. That's the purpose of being up here today. And to me, that's even more important. The vaccine, by its nature, you have to have long tests because you have to make sure what goes into somebody's body is not going to do destruction, do bad things. So you need long tests. And they're doing great with the vaccines, but it's still a long process. But the therapies are something we can move on much faster, potentially. And the treatments that will be able to reduce the severity or duration of the symptoms, make people better. Essentially, we're looking at things to make people better, or at the very earliest stages, they wouldn't even know they had it. And that's where I believe it's going to work even the best. The FDA Commissioner, Stephen Hahn, who's with us, he's fantastic. And he's been working 24 hours a day. He's worked like probably as hard or harder than anybody in the group, other than maybe Mike Pence or me. And what the FDA is doing is incredible. They've done things in times that were not even thinkable. And I've directed the FDA to eliminate outdated rules and bureaucracy so this work can proceed rapidly, quickly, and I mean fast. And we have to remove every barrier. There were a lot of barriers that were unnecessary. And they've done that to get the rapid deployment of safe, effective treatments. And we think we have some good answers. We'll find out very, very soon.
Okay, you were listening to President Trump talking about the situation from the White House. He addressed a lot of different subjects. When you take a look at the stocks right now, you can see that we are actually in green territory. That is actually good news because this time yesterday it was a much, much different story. Even though they had just had a news conference announcing economic stimulus, things dropped dramatically. One of the circuit breakers had just been triggered. Today, the Dow Jones is up almost 1%. The S&P 500 is also up. You know, in terms of who that's getting the credit for it, Apple is seeing a rise on the S&P 500. We are seeing the energy sector doing well. So this has been a roller coaster ride on Wall Street, but we'll continue to watch things for you because it just keeps changing. And as all these different press conferences and all these stimulus packages and all these votes happen, the Wall Street sector certainly reacts. We are also following the development that the trading floor is going to close tomorrow. And that is because two of the traders on the Wall Street trading floor did test positive for coronavirus. Okay, we want now to talk to Dr. Vanila Singh. Dr. Singh is the immediate past Chief Medical Officer of the U.S. Department of Health and Human Services, now on the medical staff at Stanford in the San Francisco Bay Area. Dr. Singh, thanks so much for joining us.
Thank you so much for having me, Claudia.
So there's so much that we have to talk about. Just out of this press conference held by the White House and the president, we saw the FDA Commissioner Stephen Hahn, Dr. Hahn, talking about what potentially could be used. And certainly we have been told over and over again that the vaccine is a year away, maybe 18 months away, even though it is in phase 1 of the clinical trials. Now they're mentioning these different medications, remdesivir and chloroquine, and I think there was one more, the Coletra, that they announced. I would imagine as a doctor, people are going to now be going into doctors' offices going, well, maybe can we get that treatment if we're not feeling well? And is that something that doctors are going to advise, or how early are we in that phase?
So thanks again, Claudine. So really important question, and really the point to take away from this is that there are already medications on the market that are being utilized for other medical indications, such as malaria, arthritis. In the case of remdesivir, it's for Ebola. And the key is that we know that they have a safety profile in the use that they are indicated for. Dr. Hahn from the FDA emphasized that there will be safety and efficacy trials ongoing. But this is important because this can help potentially attenuate, and the degree to which it can help is what's being looked at. In terms of use, it would depend on compassionate use and certainly the individual patient situation.
I'm curious on what kind of proof that it would have to make sure that it is going to be helpful? Because all drugs have side effects, right? They all have something that, chloroquine's a malaria drug, and certainly if you read up on that, there are things that patients have experienced that you don't want to add to symptoms, right? And really, the WHO just said last month there's no proof that chloroquine is effective. So I think it's hard for us at home who are not doctors to try to figure out what we should put hope and what we should not put false hope onto.
Such an important point about having hope but not false hope. The positive potential in this case, as the FDA commissioner laid out, is that these are already known and indicated and used medicines. So there's a head start in that. But just like you said, understanding whether, one, they're efficacious, and two, even if they are, what other potential problems might there be is what is being looked at in the clinical trial as is currently there. There's also the compassionate use indication. I believe the president also brought up the right to try, but this really goes beyond it because the data from this and the clinical trial will certainly be very informative, very important in this very unusual, unprecedented situation that we're seeing play out throughout the country as well as the world.
So now what are you telling people in terms of testing and where we go from here? Testing is going to be available in all 50 states, but if you talk to the average person, right, they're saying, I don't know what testing you're talking about. I don't know anyone who's been able to get a test. I don't hit these certain criteria and I'm not in that pocket.
Yeah, so certainly there's criteria and there's means to get online and see if you're a candidate for testing, but also calling ahead to the healthcare professionals. All of those things would indicate it. At this time, there's not an indication for those who are asymptomatic, but if you're someone who may potentially have been exposed, it's important to still ask your healthcare provider. At the end of the day, if you're suspicious, if you develop mild symptoms that are similar to a cough or flu, specifically fever, cough, shortness of breath, even until you're getting the testing done, it's best to assume that you may have it and self-quarantine. Also taking care of the high-risk folks around us, those with medical conditions that might put them at greater risk of having a severe response to a COVID infection, or those who are over the age of 65. Being aware and cognizant is really important.
How are you feeling about people's calm? I mean, it seems like we're seeing every spectrum. We see people on beaches in Florida who don't seem worried about it at all. You see people who are sheltering in place who are very concerned and scared to even go to the grocery store because of the contact with people. It has certainly created a whole spectrum of how patients and families and people who are even asymptomatic are dealing with this and the contact we have with our most vulnerable populations and our grandparents and older seniors.
So that's a great question, Claudine. It's really about striking the balance. I can tell you as a former chief medical officer who just recently was at the U.S. Department of Health and Human Services, the message about a public health issue is really about, one, being informed, doing the right steps, which we are doing, especially when you think about the shelter in and what has been going on here in the Bay Area as well as other places around the nation. But also knowing that you're doing what you're supposed to, what the guidance is, but not letting the anxiety and the stress really become a part of your daily life, because we know certainly that those have negative health consequences. And I think for some folks where the anxiety is increasing, perhaps taking a break from watching the news or hearing about school closures or company closures or the economic effects, food issues, etc., what it can do is certainly cause many traumas that might be a similar post-traumatic situation in weeks or months from now. So I think it's really important for folks to be balanced. When you're staying calm, it does not mean you're not taking it seriously. It does not mean that you should not follow and adhere to the guidance that has been put forth for public safety or good hand hygiene or social distancing or remaining away from social gathering.
Yeah, we can be cautious without panicking, certainly. Dr. Vanila Singh, thanks so much for your time and for your insight. It does help us sort through all of this as this ever changes, and we just try to keep up. Thank you so much.
Absolutely. And there is one other thing I wanted to mention was the vaccine trial.
Absolutely.
That I know you were particularly interested in. It is something that I think we can all look to first person healthy volunteer was given the vaccine on Monday, and it's in not a virus, actually. It's not a live or dead virus. It's an antigen from the mRNA sequence. And so that's really exciting. It's record time, I think 66 days to get that trial going. And that's something that is a good example of what advances we're seeing and really the hope at the end of this.
It's really interesting, yes, because Jennifer Howler is her name, 43 years old, a mother of two. She said she signed up because she saw on Facebook that they were looking for volunteers, and I think she said she gave something like 17 vials of blood, before she even took it. She's not at risk for getting it. That's important for people to know. You just mentioned that. But how important is it for her, people like her, and the other 44 or so people who signed up to step up? Someone, when I posted the story, they said, real heroes don't wear capes, and certainly these are people we need in the fight to figure out, what's going on. For her, are they just looking at side effects, how her body responds to it, to make sure that there's nothing negative?
Absolutely. This is, again, a novel virus, respiratory illness that has afflicted the human race, and so they want to make sure that the vaccinations that might have promise don't have negative effects. So there'll be a study. The study will go over about 8 to 12 months for the 45 volunteers. And just like you said, really, these are heroes. They step up, and this is what I think empowers folks and may even help address stress and anxiety. One is to know that this is happening, that folks are stepping up. A mother of two is really amazing, great story, but also that we are actively moving in that direction. The medical advancement in innovation, public-private partnerships that are going on with the private sector, helping to expedite things, could not be better or faster. And I think I heard just today that Carnival Cruises, their CEO just offered their ships and beds, should that be of importance if the medical system gets overwhelmed. So these are things that are reassuring. People can know that there's a lot of out-of-the-box thinking that's going on, repurposing manufacturing plants to help with perhaps masks or ventilators and getting the much-needed equipment. So all a really good sign that the country's really come together, as has the world.
Okay. Dr. Vanila Singh, thanks so much for that. We appreciate it, and we appreciate your time. All right. If you are just joining us right now, you could be watching on coronavirus.com. We appreciate you logging on and watching. You could be also watching on Facebook feeds throughout the country. We are going to be doing this broadcast every weekday, starting around 10 a.m. Pacific, 1 p.m. Eastern. We're going to bring you all the very latest on the coronavirus outbreak from across the world and across our country. Let's talk about stocks really quickly, because certainly it's been a little bit of a roller coaster ride. Things are in the green, though. That is a good sign. We didn't see this yesterday. Yesterday was a very, very tough day on the markets, but you can see trying to creep up into the green territory at about 1%. 188 points up. S&P 500 is also up, and so we've got some green territory that is nice to talk about. We want to go to Philadelphia right now. Financial expert and senior managing director of the Backrack Group, Jordan Shapiro. Thanks so much for joining us.
Thank you so much for having me.
So glad to see it in the green, right? For however long it's going to last.
It certainly feels good, especially from a mental perspective for those of us at home that have very little to do other than follow the news and follow the performance of our portfolios. But the market itself is struggling to find a bottom point given all of the news that we've had to digest, and quite honestly, the lack of information that financial managers have had to trade on over the last couple of weeks. It's certainly nice to see a day that has normal market activity, a moving average of a couple of hundred points versus a couple of thousand points. And I think today's press conference by President Trump and the experts around him did give the investment world some confidence that we are moving towards a solution in conjunction with the $1 trillion aid package that Congress seems likely to approve before the week's end.
Let's talk about that. Let's talk about that, because it seems like the market responds well to a press conference one day and then not as well the next day. And today it does a little bit better, and then you have different sectors, the technology sector doing better today, the energy sector doing better today. Is it something that we should be watching minute by minute? You're talking about being home and we're staring at it and people are trying to figure out what to do. Or is this, we give it a week and look at it in terms of where this goes, as we see, we're going to see unemployment.
The average American should try and not follow this news on a minute-to-by-minute basis. There are institutional investors that drive most of the market activity, not individuals like yourself and myself. And sectors are going to rise and fall based on small fragments of information that are leaking themselves out into the market. And that's been happening in a trickle. I think what we saw today that was really different was a consensus from our political leaders on what a bailout package would look like, as well as the Fed's continuing actions to ensure that the dollar flows freely throughout the global economy, and that will prevent any seizures of credit and cash flowing, as happened in the 2008 crisis, where the U.S. dollar actually had a value below $1.
Yeah. Okay. I mean, unemployment, as those numbers go up, because they are asking everyone, file for unemployment, we're going to give you paid sick leave. We have all of these, things being put into place to help so many people that are going to be out of work. How will the market react to that? I mean, we know it's coming. It won't be a surprise.
I think at this point, a lot of the negative downside has been priced into the market. Most people are expecting unemployment to spike. We saw first-time unemployment filers just this past week hit a week-over-week mark that has historically never been seen in terms of a percentage jump. And we're starting to come to grips with the seriousness of this scenario and the fact that we are likely looking at two challenging quarters of earnings and revenue for public companies in the U.S. But we also have to remember that this is a public market that's fallen by 30% over the last several weeks. And in that situation, we are trying to find a bottom of what the true value is for now and for going forward.
Yeah.
So I think that as unemployment numbers do start to come in, and those numbers are going to look not terrific on an overall basis, I think the market is expecting that and has taken the right indicators from the hospitality industry, from the restaurant and the food and beverage industry, where it has been clear for the last several weeks that we are going to go through a period of mass reductions in force, and that state and local governments, as well as the federal government, are going to have to pick up the slack and ensure that money still flows into the pocket of the consumer, which is really what's driven the economic expansion over the last several years, the activity of the consumer.
Wall Street is also changing just on a functionality optics kind of situation with the traders testing positive for coronavirus and it going all electronic. I think for people who are used to seeing people on the floor, they don't realize how much of it has been automated and electronic for quite a while. Do you see that having any disruption when the markets open on Monday and we don't have anyone physically on Wall Street trading, but people are doing it more electronically?
No, I don't think that'll have any impact. I mean, certainly the visibility of an empty trading floor at the New York Stock Exchange is disappointing to people like myself who have had the chance to visit the floor multiple times and feel the energy of the traders walking to the different stations. But trading in the public equities markets has been largely electronic for many years now, and the on-floor trading activity is limited to prime brokers and some of the large banks that maintain a presence there. So that while it is disappointing to see the building shuttered and the floor quiet, the public equity markets will continue to operate as normal, and I expect no major impact from that on the true value of the stock market.
Do you think people who have more of a financial cushion, I mean, certainly there are people who are trying to figure out how they're going to pay their rent or their mortgages next month, and there's a lot of talk about making sure that you save the money that the government is planning on sending and save any tax refunds to get through these next couple of quarters in the long haul. But those who have some financial stability and maybe have more of a cushion, is there opportunity on the markets that you see that people are trying to take advantage of in terms of buying things up right now?
Absolutely. In this type of market, the smart investors are putting their money back into stocks, and other people are putting their money into toilet paper and hand sanitizer. And that's not to demean the seriousness of the scenario, but myself and most of the individuals that I speak to and work with believe that this is an elastic economic situation and that we will soon rise again to a point that maybe isn't quite where we were 2 months ago before this crisis began. But there is a fundamental undervaluing of American companies exhibited in the way the stock market has trading down. And while I would caution anyone in a time where cash is important to hold on to go full force into the markets, I think it is important to look at this as a long-term opportunity to enter at a point that we were honestly not expecting to see based on broader economic trends over the last several years.
All right. Jordan Shapiro, the financial expert and senior managing director of the BlackRock Group, live from Philadelphia. Thanks so much for joining us and for your insight. We certainly appreciate the chat.
Thank you. Stay safe.
You too. All right. If you are just joining us, you are either watching us on coronavirusnow.com. We appreciate that. You can also be watching us on many Facebook pages from our stations across the country. And so if you do have comments, make sure you post them there. Keep in mind, this is a daily broadcast every weekday. We start at 10 a.m. Pacific and 1 p.m. Eastern. Go for a couple of hours and check in really across the country for all the very latest on the coronavirus outbreak and this pandemic and keeping you up to date. So thanks for being with us right now. We want to go to Dallas if you are just joining us, because when we talk about our viewers weighing in, we've got Dr. Angela Mohameka, who is a pediatrician running a full-time telemedicine practice, which I imagine has just become ever more important these days as people don't want to come in, but they have so many questions.
Hi, good afternoon on your side, just afternoon on our side here in Dallas. How are you?
Oh, we are good. Okay, we have lots of viewer questions always coming in, so we appreciate you joining us to answer them. The first question that we have from a viewer, and I see a lot of people trying to do this. I see a lot of postings on vitamin C and all the different things that people buy and elderberry. People asking, is there anything you can do to increase your immunity to coronavirus?
So at this point, it's really just general immunity. And what I say to people to begin with is it's important to look at this as a put your mask on first situation, right? So when you think of flying in an airline, you get in the plane and they go through their safety measures and they say if a mask drops down because of loss of pressure in the cabin, first put your mask on first before you help others. So I say that to say it's a moment for you to check your anxiety level and educate yourself. So take a break, make sure you understand what's really going on, limit it to credible sources. So the CDC and WHO are wonderful sources. The CDC has been great in terms of updating minute by minute what needs to happen in different settings. So just staying really up to date and alert in terms of what's evidence-based science in terms of what you can do to keep yourself safe. The important preventive measures here are going to be the threefold measures. So universal precautions, and by universal precautions, it's keeping your hands clean, keeping them away from your face, making sure that if you're coughing or sneezing, you're covering it using your elbow to cough and sneeze into your elbow, washing your hands if you touch your face at all, wiping down surfaces as much as you can. In terms of stay-at-home measures, you want to stay home if you're not feeling well. So that's a second piece of things. So universal precautions, stay at home if you're not feeling well. And then finally, social distancing. That's really the crux in terms of prevention. In general, what I say to my patients, and I do see patients in the office, I'm actually in one of my exam rooms right now, but what has happened in my practice is we've shifted a lot into telemedicine over the last week or so with coronavirus pandemic becoming more of a concern for some of our families. But what I say to parents is you want to make sure that you keep a baseline of health. So eat your vegetables, eat your vitamins, don't take your vitamins in a pill. If you have to, you have to. But the most important thing is get those nutrients in your diet. Eat a balanced diet, eat a minimally processed diet. It's so important now, especially that folks are home, and it's often with stress, with anxiety, with boredom, you can start to stress eat and start to eat things that are not quite so great for you. But stick to that balanced diet, stick to that minimally processed diet. Make sure you're drinking lots of water and that you're getting your rest. So keep your body in tip-top shape, continue with that healthy lifestyle, and that's what's really going to help you.
Yes, it does. It does lend itself to comfort eating, but certainly if we get a little exercise and eat well, that goes a long way. I have, you know, at this point, I think we've talked about washing our hands so many times that people are probably much better at it than they were, but I think people still have a lot of questions when they're doing it because they want to make sure they're doing it the right way. They're thinking so hard about washing their hands. They want to make sure it's the most effective. So someone asked, I wash my hands for 24 seconds. There's your 24 or 20. That's happy birthday, you know, a couple of times. But does it matter if the water is cold, warm, or hot? I think we feel like hot's better, but I think it doesn't matter.
So we don't want it hot where you're scalding your skin. That's definitely not ideal. You want it to be comfortable temperature. So the temperature you typically wash your hands in, which is for most people lukewarm water. The important thing is that you're using soap and that you're covering all the surfaces. So that 24 seconds shouldn't be 24 seconds where you're just going like this. You really want to make sure that you're getting all the surfaces between the fingers, you're getting the fingertips, you're getting the thumbs, you're getting the wrists. That's the reason to wash for that period of time is to get all the surfaces and make sure that you're getting a really clean hand.
So the temperature doesn't matter as much as the procedure. Get to know your hands better than you ever have.
Get to know your hands.
Get to know your hands. Know every little bump and nook and cranny. All right, let's talk about the folks. I mean, we have extra people coming into our newsroom and scrubbing. A woman named Jocelyn has been working night and day, you know, scrubbing and doing things like that. And you worry about them as well because they're going to lots of different places. So our next question is for the folks who are doing that heavy work of custodial and cleaning jobs. Do they need extra protection? I mean, we think about our healthcare workers a lot, but what about these other folks who are exposing themselves?
So it's really going to depend on what type of work they're doing, of course, and where they're doing their cleaning. The first and foremost thing is to follow company guidelines for your general health and safety. So your OSHA guidelines, making sure that if this is something that requires gloves, you're wearing gloves. If it requires a mask, that you're using that mask. And if you are someone who is concerned about being in an area where you might have been exposed to something, don't take it home. So bring in a change of clothes, making sure that you put the clothes that you used for your cleaning in a bag and then launder them when you get home. As much as possible using disposable gloves, that's going to be the critical piece. Even for those at home that are doing their own cleaning, making sure that you're using disposable gloves so that you can get rid of those after you clean surfaces and wipe things down.
Yeah, that's good news or good advice for people. You know, because you're a pediatrician, I want to ask you, because this has been a big topic of conversation I've seen with folks when they're talking about the younger segment of our population, that when coronavirus first was emerging, everyone was obviously focused, as we remain focused, on our elderly and older population. But children now, you are seeing cases popping up of children getting sick. And I think there's some latest numbers from the CDC that said most or almost half or 40% of the people who are hospitalized were young. It's just the people who are unfortunately succumbing to coronavirus are older. So do you fight that in your practice with any patients or families saying it can't hurt my children?
So I actually don't. If anything, I've had to alleviate some anxieties that people have in terms of children getting sick. Because what I've heard a lot from families is they liken this to influenza, and they're really concerned about their child being sick for prolonged periods of time, ending up in the hospital, and they want to know how to keep themselves safe and how to keep their family safe. In terms of the CDC findings, when they said young, it's interesting. They actually meant individuals that are in their 20s, 30s, 40s. So you're finding that 40% of hospitalized folks are in that age range. It's not necessarily the really young, as in preschool, school-age kids. What you do see in individuals in my age bracket of 0 to 18 is they have symptoms very similar to an upper respiratory infection. So that cough, congestion, runny nose, they can have a sore throat. It tends to be milder, it tends to be a milder illness. And what's most important for that age group is that parents don't do anything different than they typically do for an upper respiratory infection. So don't over-medicate a child, don't give a child medication they don't need. Continue to work with your pediatrician to make sure that you're treating this viral infection appropriately.
Yes.
And make sure that you're also keeping in touch with the school system so that if there are other cases, even if your child is asymptomatic, if there are other cases that are arising in the community, you now know that you have community spread and you can share that with your pediatrician, and it helps in terms of decision making.
Communication
as physicians, as physicians, as pediatricians, we really are focused on working with each other to make sure that we're sharing best practices, working with the local health department to make sure we understand what's happening locally so that we are doing up-to-date evidence-based work in terms of caring for our families.
All right. Dr. Momeka, thanks so much for joining us from Dallas this morning. Great advice, and certainly, yes, we are all in it together. Thanks so much.
Yes.
All right, if you are just joining us here on coronavirusnow.com, we appreciate you tuning in. We are going to be streaming every day on coronavirusnow.com. We are also on Facebook pages across the country for our local stations there, so make sure you add to comments. That's how we get our questions to our doctors and get you answers that you are looking for. We start streaming at 10 a.m. Pacific time and 1 p.m. Eastern time. So thanks for joining us as we continue to really cover how this is affecting us across the country. That leads us over to Tampa Bay, and Fox 13 Tampa Bay reporter Dan Maddox who is at the courthouse in Clearwater, Florida, where the Board of County Commissioners there is going to hold an emergency meeting at about 2 p.m. So we've got you for just a few minutes, Dan, but thanks for joining us. Do we know what they're going to be talking about?
Yeah.
I mean, certainly we've seen shelter-in-places orders go across, the country. What do we think is going to be happening there, where you are?
So if you're not familiar with this area, Clearwater, it's the big beach city here in Pinellas County in Tampa Bay. They went ahead last night and made a decision to close the beach for 2 weeks. The county, Pinellas County, is going to make that decision. They're going to be talking about it. They may not close the other beaches in the county, but they're going to be talking about that at 2 o'clock this afternoon, which is why we're in front of a building here and not coming to you from the beach.
From the beach. Let's talk about those beaches because, across the country, people are seeing these images and these video from Florida of these packed beaches, a lot of them in the Miami area. We're looking at video right now where I don't know if that's what they believe is social distancing, but from afar and from the video, it doesn't look like anyone's very far. And certainly there's a lot of pushback from places across the country, whether you're in California or New York, where you're sheltering in place, you haven't been able to go anywhere. And you take a look at all these people at the beach and you're saying, what in the world are you doing?
Yeah, that video I believe you're looking at is from over the weekend when, you see Clearwater Beach and it's so densely populated, exactly what people are not being told to do right now. That video, I do want to mention, though, over the weekend, that was when it was announced that no gatherings of 250 or more. It was later, I believe Monday or Tuesday, they went ahead and made the rule, okay, the Governor DeSantis came out and said you can stay on the beach, but you can't, no groups larger than 10 people. The governor actually was on Fox and Friends this morning saying to spring breakers, the party's over here. And they're really wanting people to stay home, to self-isolate, not be on the beach. The city of Clearwater making that decision, and the county government are going to be addressing it here not too long from now.
Sometimes, it's interesting when we've got video, right? So sometimes you show video, and I know one of the networks was showing video of San Francisco in the Embarcadero area where people like to walk, and there were a lot of people on the Embarcadero, but the other streets of San Francisco and around the Bay Area were empty. That gave an impression that maybe people weren't taking it as seriously on the West Coast and in California, where they obviously are a large number of cases. Is there a sense that the state of Florida, that video is representative of really what's happening across the state, or that there are other areas that we are not seeing where people are really taking the social distancing very seriously?
Really, I think it's where you go. The major beach cities, Clearwater, Miami Beach, Fort Lauderdale, they've all made the decision to close. I'm sure you've heard a lot of interviews from spring breakers that say they're going to keep partying. The governor's saying that that's not what people should be doing right now. So I think it's really which city you go to and who's taking it serious. But I think you have a lot of people that maybe feel that the beach is the only thing that they have left to do. You can't go to bars, you can't go to restaurants, many of which bars and nightclubs, they're closed in the state of Florida for 30 days. It's an order that the governor issued earlier this week. So you have a lot of people feeling that maybe the beach is the last thing that they can do. And there are quieter beaches, not like Clearwater Beach. There's beaches more to the south of where I am right now that are not populated and not crowded like that. So there's a lot of people that feel that they can go and that is a place that they can hang out without being in close contact and close quarters with people. So really it is it's a big debate. There are people, even some county leaders don't want to close the beaches. Others do here.
It definitely has an economic impact for anything when you close things. Is the sense that a lot of these people, obviously, it's a destination to go down and have spring break there, that if we hear these interviews of people going, I don't care, I'm going to party, it's fine with me, that there's going to be an enforcement issue even when the beach is closed?
So I can speak to the city of Clearwater, and they've, they passed the ordinance last night, an emergency declaration, I actually should say, no feet in the sand. And they're asking the county sheriff's department to enforce that. I think there will be an issue with how they enforce it. It's so broad, and there's 20-some miles of beaches here in Pinellas County. So that's going to be an issue, and we expect to learn more about that in the coming hours, exactly how they're going to address it. City of Clearwater, they've already banned it, but the other beaches are still open. And I think it's important to mention something that's also caused a lot of debate here within the City of Clearwater is they've made the decision that it's actually still open. They're going to close the beaches on Monday.
So it'll be an interesting weekend.
There's a lot of backlash. Okay, well, why are you waiting to Monday? The mayor's saying that they're wanting to compromise with people, and then a lot of people are saying, now is not the time for compromise. Close it right now.
Yep, the debate goes on. All right, well, thank you for the very latest, giving us a good picture of what's happening in Florida. Stay safe and healthy out there, Dan.
Okay, sure, you too.
All right, and if you are just joining us now on coronavirus.com, thanks for logging on, watching us on your computer if you're stuck at home or you're at work. We're also on Facebook pages, streaming all of this. I'm Claudine Wong, and we appreciate you joining us for all of this. We're going to live stream every weekday on coronavirus.com, also on station Facebook pages around the country. We start at 1 p.m. Eastern, 10 a.m. Pacific, and we bring you information from really around the country and around the globe. We want to talk now about the Bay Area and Tesla, because Tesla has been an interesting company as we try to figure out really what happens next from them. Reporter Brooks DeRose has more from the KTVU Fox 2 channel newsroom. He's been following this Tesla story, and here's what he found out.
Sky Fox found a packed parking lot as thousands of Tesla employees reported for work Wednesday.
I have coworkers that are pregnant. I have coworkers that are over 65, and they're fearful. They don't know what to do anymore.
Several workers speaking anonymously say no precautions have been taken. No sanitizer, no masks, no social distancing.
So why are we still open, exposing these people potentially to the coronavirus? It doesn't make sense to me at all.
Tesla CEO Elon Musk sent an email to employees earlier this week saying, do not feel obligated to come to work. And the harm from the coronavirus panic far exceeds that of the virus itself. Musk even compared coronavirus to the flu.
I was shocked.
Family law attorney Kelly Gamble says it only puts the community in danger.
Tesla is a germ factory. There's no ventilation. There's inadequate lighting. They don't get a lot of breaks because they're on a line.
Workers say they're left standing side by side with very few places to wash hands.
To be completely honest, this entire time we've been in limbo. We don't know what to do. We thought that they would shut down if the county shut down, and they didn't.
Alameda County's shelter-in-place directive didn't stop these buses from dropping off dozens of workers. The sheriff tweeting, Tesla is not an essential business.
They can operate at minimal levels to do and process employee benefits. They obviously have a tremendous amount of equipment there. That equipment needs to be maintained and monitored. They would be allowed to do that. They would have to do that while maintaining the social distancing guidelines.
But workers say that's not happening. An internal email sent Wednesday morning explained, we have conflicting guidance and there are no changes in your normal assignment, and you should continue to report to work if you are an essential function.
I see an exception being made for deep pockets, and I don't like that.
Tesla has not returned our repeated requests for comment, but Alameda County says the company has agreed to reduce its workforce from 10,000 to 2,500 at its Fremont plant. Still, workers say they've not been told.
All right, Brooks DeRose, let's talk about this. And I'm told you have some new information as well.
Well, I just learned that Fremont city officials will be meeting with Tesla today to talk about their violations of this health order. We also visited the plant this morning, found packed parking lots again, found those buses rolling in, but we were told there was one slight change. Now, when workers show up, they are scanned with a temperature. Their temperature is taken with a thermometer across the forehead, and they are also given a mask before they go inside. But many of those workers say it's still tight quarters. Some of them told me they work about 4 workers to a line. So what they're doing is they're working on one car at a time, and sometimes they're within feet of one another, and they have to be in very cramped spaces. and they're very worried, but they say they need a paycheck. But meanwhile, we have General Motors, we have Ford, we have Fiat Chrysler, all have halted their operations, but Tesla is still going forward and calling production as one of the 4 essential areas that a lot of workers say that's not essential at all, building luxury cars.
Well, it's interesting because I think this is where a lot of workers kind of get stuck in that middle where they want people to figure it out. They want the officials who say, this is a shelter in place, only essential operations, or the sheriff's department to clear this up for them, because if they're left to make the decision, then they decide the paycheck or they decide how the boss looks at them when all this is over if they don't show up for work, but then they go to work and they're stressed. I mean, Tesla is a good example, but certainly I think this is happening in a lot of workplaces where the employees are trying to figure out what are our rights to decide how we feel about this.
Absolutely. One of the things that Tesla is doing is it's saying, okay, you can stay home if you don't feel well or feel uncomfortable, but you have to exhaust your vacation time, your paid time off. If you run out of paid time off, you're allowed to go either unpaid, which is very troubling for a lot of people, or you can borrow 80 hours of time where they'll keep paying you. The thought is, though, then when you do come back to work, you're going to have to slowly pay that back. That's what they're telling those employees. You can borrow 80 hours, but eventually you're going to have to pay us back for the 80 hours that we pay you up front.
So is there a debate now with, the county officials to say, do you consider production essential? Because I think in the beginning they were saying it's bookkeeping, it's payroll, it's keeping some of those operations. I don't think the county identified it as getting cars off the line.
They were more concerned about the number of people and that social distancing we keep talking about. They talked about reducing that workforce from 10,000 to 2,500, not layoffs, just temporarily suspending some operations. But based on what we saw today, all the workers going in, it seems like there are just hundreds of people, if not thousands of people going into work still at this time, and you just think about how quickly this virus could spread. That's not a good thing. But we do know right now that the city of Fremont, where this factory is located, they are meeting with officials from Tesla to kind of figure this all out, because the county said they can keep some operations going, those essential functions, but what is defined as essential is what's really up for debate.
It's very complicated. Okay, hopefully they can find some resolution so those employees and those workers can also find a safe resolution as well. Brooks Rose reporting from the San Francisco Bay Area on the Tesla plant. Thanks so much, Brooks. All right, and if you are just joining us on coronavirus.com, we appreciate you joining us. I am Claudine Wong, and we are going to be doing this broadcast every weekday, starting at 10 a.m. Pacific and 1 p.m. Eastern, and we'll bring you all the latest on the coronavirus outbreak and how it's being handled across the country and around the world. We next want to go to Seattle to this interview with Seattle's mayor.
It's hard to believe that it's been less than 3 weeks since the first King County death was announced, but it has been. It's only been about 2.5 weeks, and in that period of time, we have seen the full force of what this virus can do. We're very unfortunate because the testing capability still has not caught up and was so poor in the beginning, both on CDC's ability to have test kits and our ability to test people. So we were flying blind and really missed the start of this virus in this region. Fortunately, we have some of the best research scientists who were able to determine by typing the genome and looking at the positive tests, do some modeling. It's really sobering for folks. Right now, their best estimate is that there's over 2,000 cases of coronavirus in our community. There is no vaccine to prevent this, and there is no cure right now. The only tool we have against this silent predator is distance, to stop it from infecting each other. So not having contact with someone who might have the virus, not having contact with infected surfaces. That's why we're washing our hands. It's the only tool we have. And we've seen in Italy what happens if we don't take these steps early enough. So I know how hard this has been. So many people have lost their jobs and their livelihood and their businesses shut down. When people get this, they get scared.
Yeah.
It is going to get harder before it gets better.
So is there going to be a curfew, Mayor? Would you consider, or is that under consideration? What should people be
So I think,
preparing for?
Brandy, we have to, there's not a one-size-fits-all response. We have to look from a public health standpoint to see if what we're doing is really slowing the curve of this virus. And that's so we don't overwhelm our hospital system. We will look at different tools and determine when we have to do that. Right now, there's parts of Washington State who don't have the same issues we have, but the governor has put these restrictions in place throughout the state because this virus doesn't respect boundaries. So we are not eliminating any option, but it's a dial, and we really have to say the next step, here's what we're doing. Really, for most intents and purposes, Seattle is already doing almost everything that San Francisco is doing. We're just calling it something different. Most people are not going into work because they're either working from home or unfortunately their businesses have closed. People are taking the time to keep distance between themselves. They're washing their hands. You have to do that more. You know, we're social beings, and so as you know, it's really hard.
Yeah.
But the days of big play dates and that, we've got to really stay away from each other. It doesn't mean don't get outside, take walks, call up your best friend, talk to each other, or you're walking at the same time and maybe not the same place. It's going to be a gorgeous day in Seattle. Just don't be in groups.
Yeah, so a lot has been done, but certainly there are other steps that can be taken. You mentioned the business community. I want to discuss that quickly. For the businesses that have closed, Mayor, by order of the government, people whose livelihoods are literally hanging in the balance, can you guarantee that they'll ever be made whole again?
Right now, Brandy, there's no guarantees for anybody, but it's why we're working so hard at the local and state level. We cannot get through this economically without the federal government taking significant steps. The scope of this is beyond anything that this city has been through. We know there'll be not just huge economic hits, but there's so many families already grieving or who are afraid. So that's where we're focused on is one, protecting the most vulnerable in the healthcare system and protecting the most vulnerable in the economy. It's one reason I was so proud of Safeway joining with us to make sure that we could get grocery vouchers in the hands of thousands of people in Seattle, really trying to build that resiliency for the people who need it most. That's how community comes together, and by doing those things is how I think we'll get through this best.
All right, joining us now from Q13 Seattle, we've got political correspondent Brandy Cruz. You did that interview with the mayor. I'm curious, I mean, she's very calm in terms of what she's talking about in the position now, but also talked about being caught off guard. How has the tone coming from city officials changed over the 2 weeks where you have seen this big increase in the Seattle area?
Yeah, I mean, I think it's a fair assessment to say that she sounds calm, but I would also argue that she sounded very evasive of the question of sort of what are the next steps. And, you know, just to give you an understanding of how people feel here, and I'm sure it's similar there and across the country, is they don't know what's going to come next. And so every day they wake up and they're wondering, is there going to be another mandate from the government that's going to restrict my life further or restrict my livelihood further? I would say from the very beginning of this, officials on the ground in Washington state took it very seriously. And I think that there was a lot of foresight to understand that what mattered wasn't happening in the moment. It was what was going to happen in a week or in 2 weeks. But then you got to this point where they were, you know, putting one ban in place. And the very next day, they'd put a ban that was more restrictive in place. And I think looking back, when we have the ability, whether it's months from now or a year from now, to look back and sort of gauge how was our response, I think there's going to be some people who wish that they would have put the more restrictive bans in place from the very beginning and not have had this sort of domino effect that they did in Seattle and also elsewhere in the country. But the tone of officials has remained pretty consistent here from the beginning, which is we're taking this seriously, but trying to be calm and reassure people that we're going to get through this together.
Yeah, you know, people across the country are watching Seattle because it hit you first, because University of Washington closed before a lot of other universities made the same decision. But you do hear folks, we were just talking to Tampa, and they want to close the beaches, but they don't want to do it until Monday because they're trying to compromise. As we look towards Seattle in terms of the lessons learned and really what is happening there, people also want to know that, is it getting any better? Are people getting better at socially distancing? Are people really following even those stricter mandates, or did those mandates, were they necessary because people were not following what they were being advised to do and not told they had to do?
Yeah, I think it's a little bit of a mixed bag. And Tampa is a great example. And I was listening to what your reporter was saying down in Tampa and wanting this compromise. And here's the problem that you run into. Is as the government, you could come in, and our governor has tremendous authority, as do other governors, in a situation like this, which is a public health emergency, to go in and make these mandates that impact our lives so dramatically. But the thing our governor wanted from the beginning is public buy-in. He wanted public buy-in, and he came on for days and he warned people, for instance, about the schools. You know, it was almost like he was telling them, you know, this is coming, get ready for this, get ready for this. And then one day, you know, schools closed across the entire state. And the reason the governor did that, in hindsight, at first I was kind of like, well, why isn't he just doing it? You know, stop threatening it and just do it. But I think the government wanted the public buy-in because there is an understanding here when it comes to these social distancing rules and guidelines that you can't enforce a lot of them. I mean, how are you going to really make sure that everybody stays in their home, for instance, if they do some sort of shelter in place or some sort of curfew or some sort of travel restriction in and out of the city of Seattle, for instance?
Right.
You need public buy-in and public understanding to say, okay, I understand, although I might not like some of these restrictions, I understand why they're necessary. And I feel like that's why the governor had the build-up that he did to saying, okay, warning, 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 and now we're going to do it. And I do think, by the way, that there are still some people here who aren't taking these restrictions seriously. I went to, there's a park, a city park up on Capitol Hill, which is kind of an area where a lot of younger people live. And I know we've had this conversation surrounding, you know, maybe folks 20 to 30 not taking this as seriously as they should. And it's a neighborhood of the city where a lot of them live. And that park is still full of people playing basketball, hanging out, and doing all those things. So there are certainly people who aren't 100% bought into this yet.
Yes, there always seems to be a group at the park who is playing basketball and not doing what they're being advised to do. I guess on a political spectrum, you talked about the governor, and I think what's interesting when we watch this happen across the country too is how it's all being handled individually, county by county, state by state, and that's what some people are talking about as well, whether this should be a nationwide, let's just do this across the board, all 50 states, everyone's all in. And, you know, I mean, we've seen most of the schools close in a lot of different areas. Are you seeing a lot of political unity within the state of Washington, and do you think that is helping with messaging?
Yeah, there has been a lot of unity. You know, I host a Sunday show called The Divide, and I literally have that show because there's so much division here politically. And you have, you know, Washington almost feels like two different states a lot of the time. On the east side of the state, you know, these people over there are very conservative. In fact, they want to break off from the Seattle side of the state and form their own state called Liberty. And then you have Seattle, and it's this blue progressive island. And a lot of the times you see politicians just not agree on anything. And they've really come together here. You know, the counties surrounding Seattle. So Seattle sits in King County. To the north is Snohomish County. To the south is Pierce County. And Pierce County, for the most part, they have Republican leadership. They have a Republican executive in that county. The way that they have been able to work together has just been tremendous. And I spent some time over the past week talking to the chair of our state's Republican Party, talking to our House Minority Leader in our state, who's a Republican. And they had praise for the governor. And these are politicians who I've never really heard praise the governor of our state, who's a Democrat, in any significant way. And so part of that was refreshing. And I'll just note, you know, especially when it comes to the relationship between our governor and the White House. Our governor he ran for president. He ended his bid pretty early.
Yep. Oh, and it looks like we actually just lost Randy Cruz, political correspondent from Q13 in Seattle, but giving us an update on the situation there. All right, if you are just joining us, I'm Claudine Wong, and thank you for joining us on this coronavirusnow.com broadcast. We're also streaming for you on Facebook pages across the country. We appreciate you coming in. We are going to start every weekday, 10 a.m. Pacific, 1 p.m. Eastern Time. And we'll go for a couple of hours giving you reports from across the country and across the globe. If you are just joining us right now, I want to give you the latest numbers because that's always a good place to start, to give you a good picture of how coronavirus is affecting us. We were just talking to Washington, and you can see Washington, California, New York there on your screen. Those have the most cases. New York has the highest number of cases. When you talk about the United States, more than 9,300 cases. New York has 4,152. Washington, 1,187. California, 870. So those are the majority of the big kind of gatherings or big clusters, we should say, of cases. When you talk about the total number of deaths in the United States, 150 deaths is the number that we have right now. Fox tracking those numbers for you. So we will keep an eye on the situation. Obviously, it changes hour to hour and it changes day to day. Let's talk about the stocks because the market has been on a roller coaster ride, but here's something we like to see. It is in green. The Dow is up 287 points, just over 1%. The S&P 500 also having a better day. They're up a little over, or almost 1.5%, 2,400. So it is a good day on the markets in terms of getting in the green because we saw a much different situation yesterday. All right, we want to take you back now to Dallas because we've certainly been getting a lot of questions from our viewers who are tuning in. We've got Dr. Mo Mecca joining us again. You do a lot of telemedicine from Dallas, a pediatrician as well, but you are in one of your exam rooms because people are still coming in. And here's a question for you from one of our vulnerable populations. This viewer saying, I'm 80 years old and I babysit my granddaughter. She's 9 years old and out of school. But am I still at risk? Should I still be babysitting her? And this is an interesting question because a lot of people have childcare dilemmas right now and kids love their grandparents, but is this a safe thing to do?
So that's a great question. And I think it's really a case by case question. You have to make sure in terms of exposure that you are aware of the child's exposure themselves. So if there's ever a risk that that child has been exposed and maybe a risk to the grandparent, then no, that grandparent should not be babysitting. And that's something that the parents, of course, would want to make sure of. The risk goes both ways. I know we're concerned, of course, about the elderly and about them staying healthy, but also with a 9-year-old, the risk of them contracting it from an elderly grandparent. You want to continue to do those 3 core things. If you are sick, stay home. At all times, follow universal precautions. And I mentioned it before. So wash your hands, keep those hands away from the face. Absolutely. And it's so hard for us to keep our hands away from our faces because we're always doing something with our faces. But if you do stray to your face, wash your hands. Wash it with soap and water, both things. And as I mentioned earlier, wash all surfaces of your hands. And then finally, social distancing. So as much as you can, even in that babysitting situation, make sure that there isn't very close contact. So again, you're limiting your possibility or your potential for spreading the virus. That's how we flatten the curve through those 3 measures. That's really what we have to continue to drum in our minds and in everyone else's minds.
We can't be reminded.
It's what I promote. Yeah, it's best that we're promoting it and we're also practicing.
Okay, here's another question. So a lot of people are sheltering in place around the country. They're trying to at least stay at home, even if it's not an official order. But let's say a family member does test positive for COVID-19. What should the rest of the family do? Or even if they have the flu or they have a fever, I mean, and you haven't had a test or a positive, confirmation of COVID-19, what do you do with that one family member who's sick?
So quarantine really means quarantine. And I've had a few family members where this has been the case. It really means that person needs to be separated from the rest of the family, whether physically separated, so a separate room, their cups, their plates, whatever they eat with, whatever utensils they normally use, other things that are going to touch their face. You want to make sure that is unique and specific to them. The second thing is, once again, continue to practice universal precautions, continue to wipe down surfaces, use disposable gloves when you're wiping down surfaces so you can get rid of those gloves. Make sure that you're practicing social distancing, and also make sure that you inform other people so you don't have others also coming into the home who may be exposed. And I think it can't be overstated. This is not the time for play dates. If your kids are home from school, it's not the time to go meet the friends around the corner or whatever else. It's really time to be home.
Theoretically, if you have one person with coronavirus, you should just assume that you could be asymptomatic and also be able to spread that to the next person or the next person who comes to your door.
Yes, and you make a great point, Claudine, which is that asymptomatic individuals can be positive for coronavirus, and you can be asymptomatic for several days if you even become symptomatic. So it's so critical to follow these measures because we can't just know by looking at someone, yep, you have coronavirus.
You had it. Yeah,
you
no, I
still
mean,
have to,
we all talk about that. We all feel
measures.
like could we have already been exposed? Could we already have had it? And, you know, we're walking around because we feel fine, but that's again the social distancing part. The other question that we're getting is, you know, I talked to a man yesterday, Carl Goldman, who was on a cruise ship, had COVID-19, was quarantined for a month. He had positive tests for a month, which makes you wonder how long it takes to actually recover from COVID-19. We hear this 14-day, you know, kind of quarantine issue, but you know, when you interview someone who had positive tests for a month, it gets a little confusing.
It does. And to be fair, the line I've used often is the more we know, the more we know. These are early days. We're still really sorting out what is going on with this virus and how the pathophysiology of it is, how the virology of it is, et cetera. So really what we know in terms of what's evident so far is you can continue to shed virus when you're asymptomatic and even several days after you've resolved your symptoms. In very small studies, they have shown that there's virus shedding even 30 days after symptoms first started. But again, the more we know, the more we know. It's really early days. So we really have to make sure that we're using credible sources in terms of understanding where we are in knowing what coronavirus is and how it can be spread and how long it can be spread.
And just to be as careful as we can. Okay.
Absolutely.
Dr. Angela Momeka, thank you so much again. We appreciate it, and we appreciate all the latest information. All right, and we have some new information coming now that I'm just getting. There's a statewide shutdown. Governor Abbott has announced that all Texas schools are closed. They're still going to try this online learning that a lot of school districts are doing. Restaurants and bars are closed to dine in. So we know that they've been trying to keep these restaurants and businesses going by allowing takeout. No groups of 10 and more. And there are going to be more guidelines in executive order today. So Texas joining a group of people who is starting to strengthen the restrictions on people. It will start tomorrow at midnight and it goes through April 3rd. So again, that is the breaking news that we're just getting for you, that there is a statewide shutdown in the state of Texas. The governor there, Governor Abbott, just announcing that is going to happen. Schools are all going to be shut down. And so certainly we'll be following the developments there. If you are just joining us, we'd like to welcome you to our daily coronavirus update live from Fox. I'm Claudine Wong. We are streaming for you right now on Facebook pages. If you have questions for our physicians, you can put it in comments below. If that's where you're watching, you can also watch us on coronavirusnow.com. We start this particular broadcast at 10 a.m. Pacific and 1 p.m. Eastern time to give you all the latest information from really around the country and around the globe as it comes in and as we get it. We wanted to take you now actually to Texas, to Dallas, and we're going to talk to Rick Holland. He's the Chief Information Security Officer and VP of Strategy at Digital Shadows. This is big news coming from Texas that everything is shutting down, but we want to talk to you about something else because this is a story that really is affecting everyone outside of Texas and beyond. It's a frustrating thing every time I hear about people scamming people during times of crisis, but it seems to happen every time.
Yeah, it is pretty sad, isn't it, Claudine? Yeah, my name is Rick, and I'm the Chief Information Security Officer of Digital Shadows, and we track cyber criminals, kind of scum of the earth in these moments, as you kind of alluded to. And one of the things that we have seen them doing is trying to trick people into clicking on things that they shouldn't click on to make money on it. They're really capitalizing on our fears and anxiety. Scum of the earth type of activity is what I like to call it, and it's quite sad.
So there are 3 different kinds of ways they do it. I mean, you talked about that clickbait where they're like, you know, check this. I mean, we've learned to be a little bit better, I think, about checking the addresses of if it says it's from Apple, making sure that it's actually from Apple and not from some random email. But you're breaking this down in categories of like phishing and selling and misinformation. I saw an alert on my Facebook page from a local police department that said someone's calling and saying, you can reserve your vaccine shot if you just give us your credit card right now. And the police department was like, you know, let's be clear. The CDC is not trying to gather your credit card information right now. Is this what you're seeing more of? I mean, have you been able to categorize into what really is being the dominant grab of what identities and information?
We're seeing that example across the world. We saw something in Nigeria that was quite similar. I get a little bit worried about, I haven't seen it yet, but that example, school districts, you just mentioned the governor of Texas, sending out emails and people clicking on those types of links. So we're seeing the emails, we're seeing in social media, the criminals are quite adaptive, and this is a unique time in history. I cannot think of a time from a cyber criminal's perspective where the entire world could be your target, because everyone wants to click on a link. Everyone wants to get more information. Everyone wants to buy something new because they can't find N95 masks. They can't find that. So the cyber criminals have a unique opportunity to capitalize on all of our fear and anxiety.
So it's interesting. It's in our shopping habits and just in general, and our fear. What is the best advice then you give people? Because it is hard. And people were at their computers. We thought we were online before a lot. Now everyone's stuck at home and literally is just sitting there online and trying to figure out what else they can do when they feel helpless. What's your best advice?
There's three things that I'm recommending to people, and we kind of alluded to one. Don't click on any links right now. If you have a link in an email, absolutely don't click on it. If it's a link in social media, don't click on it, which leads to my second recommendation, which is to independently verify any communications that you have. That example that you mentioned with local law enforcement, go to the website of that law enforcement agency. They will have announcements there, but don't trust anything that's in social media or an email. And then finally, a really important one, I think, is informing our elderly friends and family. It's kind of a double whammy, if you will. The most at-risk population is also one of the most at-risk populations from a cybercrime perspective. So while we may have good cyber hygiene, many of us that are used to looking for suspicious emails, the elderly don't. So have this conversation with them. Tell them not to click. Tell them to verify. If they have a question, ask a family member that may be more tech savvy, because it's quite sad. We're online more, we're exposed more, and cyber criminals are going after the vulnerable people.
Get a second opinion always, and I would also suggest don't share things. Don't send it out in what might be fraudulent. Rick Holland, great advice and much needed, unfortunately, in this time to keep people safe from more than just coronavirus and keep people safe from those who prey on us. All right, thanks so much, Rick.
Thank you very much. Stay safe.
You too. All right, if you are just joining us, I'm Claudine Wong, and this is your coronavirus update. It's a live update from Fox. You can watch us on coronavirusnow.com. We are also streaming on Facebook pages across the country. We are getting questions answered from medical professionals, so if you have questions, make sure you leave those there. We are also going to start the stream every weekday. Just to remind you, it's at 10 a.m. Pacific and 1 p.m. Eastern, so we invite you to always tune in. We've always got great guests, and we really try to give you a good picture of what's happening around the world and around the country, because it changes hour to hour and it feels like minute to minute. I want to now take you, when we talk about going around the world, I want to take you to Rome, Italy, and to talk to Catherine Wilson. And I'm really excited to talk to you, Catherine. I read your blog about this article even before I knew I was going to get to talk to you. I read it, when you first wrote it. The title is, "I'm an Italian mom under coronavirus lockdown. Here's what I wish I had done differently before things got bad." When you wrote this, did you think that it would go viral as it did?
I didn't. I wrote it because I really was seeing in the United States me 2 weeks ago, and the things that people were saying and talking about were exactly what we were thinking 2 weeks ago, because there wasn't a total lockdown. So we were allowed to do things, but everybody had slightly differing opinions on how much was too much. Well, we can go out, but maybe a meter, maybe not a meter. Maybe we can have play dates, maybe not. And I think that now Italy really is in a state of war. And I just felt so much the necessity of telling Americans that we are saying to ourselves, why didn't we learn from China? Why didn't we do a complete lockdown earlier? And I wish that Americans could learn from us.
Because I think there is a lot of peer pressure, and specifically parental peer pressure at the beginning of these, because you've got these children that are kind of locked up in the house. And when I first read your article, it was kind of after a back and forth with a group of parents. Of some parents were saying, yeah, let's meet up, and some parents were saying not, and you felt like, gosh, am I overreacting? Am I going too far? And your kids are definitely saying, yeah, you are. And so it was really hard to kind of hold the line.
Hi.
You do these
Can you hear me?
Oh, I've lost you. It looks like we are having a little bit of a technical
problem. Can you hear me?
I can hear you. Can you hear me? Okay, we're going to try to figure out what is going on with Catherine Wilson in Italy. As we try to get through from country to country and across the world. But we do want to talk to her more about her blog. And Catherine, I think, have we fixed this? Catherine, can you hear me now? All right, that's Catherine Wilson that we're trying to get from Rome, Italy, and she's an author and wrote an article about things that she wished she had done. And Italy is about a week ahead of us in terms of the curve that we're looking around. And so that is, it's always good information. Catherine, do we have you back now? Okay. We're going to keep trying to get, oh, I think I hear you. Catherine, can you hear me?
I can hear you.
Oh, you're back. Yes.
Oh, excellent.
Modern technology. Okay, let's get right to your do's and don'ts, because as we were talking about this, you say do keep your kids at home, do let go of screen time concerns, do shop responsibly, do make arrangements for your family if you've got people traveling abroad or something to come home. Don't pay attention to what other parents are doing, and don't obsessively read updates. All great advice. How long do you think it took for Italy to follow that advice?
Well, the restrictions were gradual. So just like is happening in the United States, it starts out with sort of advice and then it becomes law. And now we're at the point where we know how dire it is, because today we saw the coffins in those big army trucks. And when you see that and you realize, oh my Lord, we really are at war, you realize that all of those gradual measures maybe were a little bit too gradual. And so I do wish, as I said in the article, that I hadn't listened to what other people said. We were invited to a friend's house for dinner just 10 days ago, and we thought, well, it's just one other family and the kids wanted to go, and let's, tell the truth, when they have no school, you feel like there's a little bit of liberation. There's a little bit of, well, we can stay out a little bit later, and, we're not in a big public place. But I'll tell you, from 2 weeks in, I go back and I look at everything I did in those days, and I think, was it really that important for my kids to socialize? Was it really that important to see that family? Because now that we know that this virus can spread in asymptomatic people, how did we know that we weren't either spreading it or getting it?
Yeah. In terms of people. I can see the people in places where shelters in places are happening, and the restrictions are getting stronger in some states over other states, depending on how many cases are there. And people are already looking for light at the end of the tunnel. And that's why we look towards Italy and say, is it going to get any better? And okay, it looks like, as you can see there, that we lost her again, unfortunately, because Catherine Wilson, coming to us from Rome, had lots of good things to say. Fortunately, technology works this way, and sometimes it happens. So we enjoyed that conversation.
I'm right here. Can you hear me
at
all?
And you're back. There, you're back. I wonder, and you are here again. Okay, just our last question. Doesn't sound like it, but we are hoping for you, especially you are ahead of us.
My kids every night at the dinner table say, have we peaked? Have we peaked? That's the real question. Have we gotten to the point where we're either going to plateau with the numbers of contagion and mortality, or is it going to continue rising? And for now, we just don't know yet, because the measures that were put in place the strict measures were about 8 to 9 days ago. And so we're waiting just a few more days to see whether that has done anything in slowing the virus, because we're farther south from the epicenter. And so what we're hoping is that the experience in those clusters in the north, seeing what has happened to the hospitals there, has meant that this lockdown in all of the rest of the country has, if not stopped the spread, at least slowed it down so that the hospitals can manage. So we see the graphs still rising, but we also see people coming to terms more seriously and more strictly with being at war, which is what really it feels like right now.
Well, Catherine Wilson, thank you for sharing your thoughts from across the world, and our thoughts are with you, and we wish for the peak, and we wish for the flattening.
Thank you so much.
We wish for the best for you. Thank you for your time. All right, if you are just joining us now, thank you for joining us here on our coronavirus live update from Fox. I'm Claudine Wong, and we bring you this on coronavirusnow.com. We also bring it to you on Facebook pages across the country. We come to you starting at 10 a.m. Pacific and 1 p.m. Eastern every weekday, and bring you the latest from, as you saw there, around the globe and, of course, around the country. We want to go now a little bit closer to the U.S. and in the U.S. We want to go to Phoenix because we want to talk to Dr. Asharina Reem, who is a licensed clinical psychologist. And wow, you know, we're just talking to a parent in Rome who every night her children ask, have we hit the peak? I mean, if that doesn't tell you, you know, how much it has, you know, kind of enveloped families across the globe, I don't know what does. In terms of addressing this anxiety, it's a real issue.
Absolutely. Thank you so much for having me. I know that a lot of the parents that I speak with as a clinical psychologist and a lot of in my personal and professional life, anxiety has been a very big thing that has come up for families, rightfully so. And something that I know about anxiety is that when we feel uncertain or unsure about anything, we tend to fill in the blanks with the worst case scenarios and catastrophic thoughts. It's really important as parents that we are reassuring our children that we are safe, we are doing everything that we can to remain safe, and that we're going to continue doing that. So there's a number of things that I talk to parents about regarding how we can reduce anxiety, and some of those things being mindful of what we consume. So we just heard about how anxiety provoking it can be to get so many updates. We might need to be limiting some of that time that we are watching the news and getting an influx of information. We might need to be mindful about, you know, who we're communicating with, whether it's family or friends, and you know, setting boundaries with some of those conversations, setting boundaries with social media, because we know that this can be a lot of information to take in.
I think it's probably trying to find the channels that also decrease it instead of increase it is pretty important. I wonder, when you're talking about having a plan, you know, I've seen people post all sorts of kind of, you know, amusing plans when they've got all their children at home and they're like, okay, you know, we fight here, we kick them out here, we feed them here. But do you think, in terms of just settling us all down, I mean, we're used to going to work, going to school, doing these things. Our days are very structured just in daily life. And now, you know, I had a friend who posted, she goes, okay, I've cleaned the closet, I've cleaned the kitchen, I've organized shelves, and it's 11 a.m. Now what do I do? How important is it for us to, you know, kind of restructure our what life looks like for us, and how will that help with our anxiety?
It's really important to remain flexible. Like anything in life, when we set a plan, we find that it doesn't always work out that way, right? So we set some semblance of a routine, but know that this is a time that we're going to have to really pivot and readjust very frequently, and that's okay, because when we set really unrealistic expectations, this is where we're leaving room for disappointment and frustration. But we also want to create space where our kids can talk to us, because they have a lot of anxieties, and let's not minimize what's going on in their lives. So we want to create space where we're asking them what they do know about the coronavirus, because likely they have heard about it from classmates, from teachers, from friends. We want to be there to listen to them without shutting them down. And we want to also dispel any myths that we may be picking up from them. And again, reassuring them, but letting them know that they can talk about their feelings, they can share in those feelings, and we can share in them together. And that whatever we're doing day to day, knowing that like it's never going to be perfect.
Yes, I would argue too that I think kids, they get on the internet, and even though they know Wikipedia, it can be added to by anyone, even though they know, you know, we were just talking about scams that were, you know, in emails. They're not as well versed in why something that says, look, we found a cure, it should be done, is not true. And they're much more susceptible to believing it, I would argue. And so is maybe some of the monitoring that, and they're probably looking up current events in a new way that they didn't 2 weeks ago.
Yeah, absolutely. They're getting a lot of information, maybe even from social media, from friends. So it is important to kind of be the gatekeeper of that information and checking in with what they've heard, so that we can make sure that they have that sound information, and we can really help to reduce some of that anxiety by reassuring them.
So a parent calls you and says, Dr. Ream, okay, what should I do? What are my 3 best tips or 4 best tips to make sure that I mean, we can't guarantee that it's going to be smooth and it's going to constantly change, but what can I do to really just kind of set myself up for at least some measure of success?
So a lot of people will be talking about how we can, physically remain healthy and consuming good food and getting sunlight and doing all these things that are going to be obviously very helpful. And I think that's really important. But when it comes to reducing our anxiety, it's very important to be mindful of your thoughts and identifying those thoughts and saying, is this anxiety speaking or is there validity to these thoughts? So we might want to capture those, write them down, start to really challenge the negative thinking process that we're having, but also incorporating something that makes you feel good, relaxation skills. These are some things that I work with my clients every single day. And this is where you can invite your kiddos to do that with you.
I did a meditation app last night. It was great.
Absolutely. That's the way to do it. I have my 3-year-old do this with me. It's really helpful to get them involved because it teaches them that, we have big feelings and we can address them together. And this is how we manage it.
Do you think it's important too? Because I think, we always say if as a parent you're not exercising healthy, exercise habits or you're not eating well, it's really hard to instill that with children. I would think if you're at home super stressed and anxious, it's really also hard to, tell your children that they shouldn't be anxious and stressed because they're really, really feeding off, and now you're their only world. You're what they're staring at the most.
Yes, you nailed it, and that's exactly it. We can't tell our kids to don't be stressed and don't be worried if we are very stressed, and the best way that we teach them emotional regulation is by regulating our own emotions and showing them, it is okay to have big feelings, but it's also okay to do things to help ourselves navigate this journey. So obviously relaxation skills are very important, using, YouTube to look up stuff like that, looking up really good apps like Headspace or Calm or something where we can find deep breathing exercises, but also just the conversation. I think that is so incredibly important to keep that open dialogue with our family during this time, to ask how they're doing and also give them the space to be honest about that.
Yes. Thank you, Dr. Ashreen Ream. Thanks so much for that, clinical psychologist. It is certainly helpful to figure out how we can all address the anxiety that we are all feeling. We appreciate your time.
Thank you so much for having me.
All right. If you are just joining us, we appreciate you coming to this broadcast. This is coronavirus update, our coronavirus update, I should say, live from Fox. I'm Claudine Wong. You can watch us on coronavirusnow.com. We are also streaming on Facebook pages. We are checking in with doctors and professionals to answer your questions. So if you have questions, make sure you drop them in the comments below and we will see them there. We are going to come to you 10 a.m. Pacific, 1 p.m. Eastern, for a couple of hours, take you around the globe, talk to experts from around the country as we really try to wrap our brains around everything that's happening. When we talk about the latest numbers, we have had, big numbers coming in, and let's give you a look at the map of the United States because that's where we kind of give you the best look at really where the latest numbers are. Fox has been tracking these numbers. So when you talk about total number of cases, you've got more than 9,300 across the U.S. Total number of deaths, you are at 150 deaths. If you take a look at this map, though, you can see California, Washington, and New York are in a brighter orange. And the reason that we've done that is because those are the states that have seen the highest numbers. New York has 4,152 cases. Washington has 1,187 cases. California has 870. If you take a look from around the globe, we just got an alert that Italy, this is from the AP, Italy has also overtaken China as the country with the most coronavirus-related deaths, registering 3,405. We just talked to a mom who is in Rome, Italy, and she talks about images of caskets being taken down streets in the country. And so that is certainly a very sobering image to imagine, and certainly one that we do not want to see here. In terms of the stock market, because this is something we are also watching carefully. If you remember yesterday, at this time, we had the circuit breaker hit at about 10 a.m. Pacific, 1 p.m. Eastern at 15 minutes because there was a more than 7% momentum dive. This morning, what we have seen is a slight increase into positive territory. So we're seeing that on the Dow and we are seeing on the S&P 500 and we are certainly glad to see those numbers. The president announcing that the Family First Coronavirus Response Act would go forward. That offers paid sick leave. Workers get 100% of their normal salary for 2 weeks. It also provides free testing. So that vote was passed 90-8 in the Senate, so that was good news. And it seems like Wall Street responding well to that. All right, we've been talking about the questions that you have about really how to handle the coronavirus. So we're going to take you to Los Angeles now because we have Dr. Larry Burchett. Am I pronouncing that correctly?
Burchett, that's right.
Burchett, all right, great. You're coming to us from Venice Beach, and we appreciate you joining us because people really, as the information comes in, it's so complicated in terms of what we all should be doing. And I think, you know, the use of hand washing and hand sanitizers, we've talked about that, but then everyone has their individual situation. So that brings us to our first question, and we appreciate you weighing in on this. Okay. This person says, sure. I'm a cashier. How safe are we? We touch a lot of products and money. What should we do to keep us safe and our customers safe? And certainly, I mean, even in the shelter in places that we have seen put into effect, the grocery stores are very busy places, and certainly this is a big concern.
Yeah, absolutely. I share that concern. So if you think about how the virus is transmitted, I'm thinking about a cashier who's there, you know, touching all of the food and interacting with people as they go by. Let's say there's a potential exposure that they may not know about. This is what I would tell them if they were my patient. You know, number one, getting it when they touch food and then they go to their mouth, their eyes, whatever, is one potential way of transmission. Now, a mask for the cashier may not prevent it, but it might keep them from touching their face and their mouth. So using a mask and eyeglasses may help, you know, cleaning your hands with hand sanitizer as much as possible. And then it's hard. There's a bit of unknown with them, with the people that are coming through there. They potentially could be exposed.
And trying to even get a mask, it is maybe a complicated process as well. I mean, would you
yeah,
have
I
them
think the
do,
point is just kind of
any kind of covering at all?
Well, I think the point is that to try to do something so that you're not touching your face, your mouth, your eyes, and you're limiting your exposure to this thing as best you can. You know, kind of similar to us in the ER on the front line, people that, you know, have to be out there doing their job are unfortunately at some risk.
Yes, and certainly
these are the best things I think you can do if you're going to be in that situation.
Right, certainly there's literally no 6 feet of distance in a store, even when people are trying to do it, unless you're going to limit the number of people in the store. And even when you're at the cash register, you're probably, what, 2 feet away? Maybe a foot,
That's
you know?
not a bad idea. So maybe when somebody's waiting as they're running their food through there, you ask them to kind of, in general, they have a policy where they stand 6 feet away. I think that's a reasonable idea that could potentially help.
I think some of the smaller grocery stores have started to do that. Maybe we'll see that as a more common thing. Let's talk about people with underlying health conditions. I mean, we talked about people with diabetes or the elderly population. What about people with asthma and allergies? I mean, those are two separate things, but I think anything now that we know about respiratory and breathing, what about their risk with the coronavirus?
You know, your question says, do people with asthma and allergies have high risk? I wouldn't call that high risk. Maybe slightly. Allergies, asthma, depending on how severe. A little bit of asthma that flares up every couple of years, not as big of a worry as somebody who has asthma attacks every month. The people who are really at high risk are the folks who have smoked their whole life, who are needing oxygen at home to get enough oxygen into their blood to begin with. Those are the guys that we're really nervous about. But my advice to everybody with any chronic medical conditions is get it in tip-top shape that you can in terms of being on the right inhalers, using appropriate allergy medication and nose inhalers to get it in the best condition you can in the case that you get sick, so that you're the most resilient and robust that you can be going through this. And that goes not just for respiratory disease like asthma and allergies, but high blood pressure, diabetes. Make sure you're taking your right medication, get your blood sugar down, and so forth. I think this is a good time for the people that are high risk to do the best they can to get in tip-top shape.
Yeah, no, it's a great advice. What about seniors and doctor's appointments? Because, you know, we've told seniors really, they were the first to be told to, you know, stay at home, kind of isolate if they can, just for their own safety. But doctor's appointments can be important, and some of the telemedicine, I would think that seniors aren't as comfortable with.
You know, when at all possible, you brought up telemedicine. I think that's a great alternative to coming in and potentially exposing yourself. I mean, I think about waiting rooms with people coughing, absolutely a risk for the disease to be spread in there. In the ER, we have people check in and then they go and wait in their car so that they're not potentially exposing a waiting room of people to their cough and
Well, that makes
potential
sense.
corona. You know, it's going to be a case by case thing. People are still going to need medical care. So there is a slight risk to coming out, going to appointments and all that. And each clinic and office is going to do everything they can to minimize that risk to people, but there is still a slight risk. So, you said it, if telemedicine is possible, I would really have people, look into that. See if you can, definitely the things like medication refills and these kind of things that can be done over the phone. Let's do that instead of coming in. But there are going to be some things that you have to come in with. And unfortunately, there's going to be a little risk to that. So then you do all the other things we're talking about, social distancing, washing your hands, not waiting in a waiting room, but waiting in your car, things like that to minimize that.
Certainly, we don't want them to not communicate with their doctors as well if they need some kind of medical help in any way. Let's talk about, how coronavirus travels, because certainly you're talking about social distancing, you're talking about, just taking as many precautions. This question is interesting because could the coronavirus travel through the vents in an apartment complex? I think it's because people are in close quarters, and they're looking at those cruise ships and saying, well, my door isn't that far away from, maybe on a ship on how close someone would be. And if everyone's stuck in their houses and their homes and their apartments, are they at risk?
Yeah, I have no idea. I don't know. I'm not going to lie.
Well,
on this
right,
one. Look,
I have no idea either. I
gotten,
was like, well, maybe.
I have gotten a lot of questions. I mean, the questions never end when it comes to how can I get this thing? And what if I'm in an elevator and on and on and on? Look, within 6 feet, close contact, somebody sneezing, coughing. I was talking about, look, if you French kiss somebody who's got corona, you're going to get it, right? You're going to get that virus. On the other hand, somebody that walks across the street who's got it, that's not really an exposure. And then there's a lot of gray area.
There's gray. Well, you're living in a house. I was talking to someone who was saying you should practice social distancing in your home. I'm like, well, if you got a family, everyone's touching everything, and you're probably generally all exposed to each other.
Yeah,
That battle's
I don't know
kinda,
that social. Yeah,
the battle kind
I
of
agree
lost.
with you. Like if you're living with people, I think it's safe to assume between dishware in the kitchen and all of that in the same house you're probably exposed. I frankly don't know the answer to your apartment ventilation question.
I don't either. So in the boat we are, the same boat. Let me ask you this though, because in the ER, I mean, those are the places that are going to get hit first and the hardest in terms of if we see what happened in Italy happen here. How concerned are you? How much anxiety? As a doctor, you want to help everyone who comes in, and you want to have enough masks, and you want to have enough respirators, and you want to have all of the equipment that you need. How are you feeling about that these days?
I think all of us that work in hospitals and in healthcare, not just doctors, but nurses, respiratory therapists, there is a palpable anxiety and stress level. This may sound kind of funny. There's also kind of a excitement about it. This is an opportunity this is what we've been trained to do, and to kind of go to the front lines and serve our country and the people and respond to this calling. I mean, certainly it makes us nervous. Thinking about personal protective equipment, this PPE you're talking about, there being shortages. I'm going to do my best to wear all that. And certainly, I don't want to give something to one of my patients. I've kind of resigned myself to I'm probably going to be exposed and get this thing at some point. I'm 41. I'm healthy. I'm going to be okay. I worry about some of my older colleagues, doctors, nurses that are still working, that are in their 70s and have medical conditions. There's a lot of true bravery and courage that a lot of the workforce is showing and going out and still going to the front lines. So it does make you a little bit nervous, but also, I mean, we've never had something that's kind of like, there's never been a draft for us, but this is that kind of thing where it's like, God, I'm 40 and healthy. Like if I didn't go, who's going to go? Like there's a sense of duty and purpose to it that yes, there's risk. We're nervous. We're coping with it in all different ways, trying to keep things light. But, you know, this is a time to, you know, see people step up. And one of my bosses, I just found this really inspiring, but somebody had to be intubated. It was actually a young person who we suspected corona. Weren't able to get the test back fast enough. And when we put them on the ventilator, it's kind of a high-risk procedure. There can be a lot of droplets that come out, and you can get exposed as a doctor or nurse. And the patient was admitted to the hospital. Really, it was probably somebody else's job, but my boss in the ER just went there and did it. He just went in there, stepped up, and did the intubation. And he wasn't even on duty right then. He
Didn't
was
even
just
have to do it.
managing things.
Well,
I was really impressed and inspired with that he did that. I thought that was courageous.
Yes, that is it is an inspiring story, and the stories of bravery are the ones that are going to get us through this very difficult time. Dr. Burchett, thank you so much. And if people haven't said it enough, thank you for what you do and for taking care of us when we need it the most.
It was good to talk with you. My pleasure.
All right. And if you are just joining us, thank you for joining us for this coronavirus update live from Fox. I'm Claudine Wong, and we are coming to you every weekday, starting at 10 a.m. and Pacific and 1 p.m. Eastern Time. We come to you with the latest from around the country and the globe, the latest on the crisis and the coronavirus pandemic that is taking over our everyday lives, really everywhere. I want to go show you a live picture right now from San Francisco, California. There's the Bay Area. We've got San Francisco Mayor London Breed. She's going to join city officials. This is actually the Emergency Operations Center. And so this is where she is planning to hold these general updates on the city's response to COVID-19. If you think about San Francisco right now, San Francisco is under a shelter in place. And so that means no one is being told to go anywhere. This presser is about to start, but we have another one that's ongoing right now. This is the one the president was talking about earlier that he was going to have about FEMA. There's Vice President Mike Pence as well. Let's go ahead and listen in.
And I want to add our thanks not only to the great team here at the National Response Coordination Center and FEMA, as FEMA takes the lead in implementing the policies that you approve from the White House Coronavirus Task Force. But as you do continually, Mr. President, I want to thank all the governors that are joining us today. Today is an opportunity to talk about the progress that we are making on mitigation, on testing, on supplies. We understand as FEMA's mission that this effort through FEMA will be locally executed, state managed, and federally supported. And I want all the governors to know that we are with you every step of the way. We are absolutely determined at the President's direction to make sure that you have the resources and the support as you see to the health and well-being of your communities. We commend the governors. At this point, Mr. President, as we told the country today, 3 states are 50% of the coronavirus cases in America today. So we're focusing resources at the point of the need. The governors in those states, their state health officials are responding with great professionalism and great speed. We'll continue to support those that are directly impacted. But by standing up through your national emergency declaration, Mr. President, standing up FEMA, and standing up the National Response Coordination Center. We want our governors, we want all of our state and local health officials to know that we are, as you say, bringing the full weight of the federal government to bear to support our states and our local communities, and that we'll get through this coronavirus and we'll get through this together.
I agree with that 100%. Thank you very much. And for the media, I guess perhaps you're going to stand aside. We're going to have the screen right behind you, and we'll start opening this up to the governors, if that's okay, please. Yeah, go ahead.
One question for you? Okay.
Okay, who is that speaking?
Hey, this is Brian Kemp from Georgia, Mr.
Hi.
President. Can
Hi,
you hear me
Brian.
all right?
I can hear you fine. Thank you, Brian.
I just want to thank you all for the constant communication. I applaud the move to stand FEMA up at level 1 through HHS and all that they have done. I had just 3 quick things for you. One, I just want to encourage you all to leave the directive for the National Guards with the governors.
Okay.
As you all know, I think we're on the front line of the fight, and we're in the fight with you. But I believe that we can best make those directives based on what's going on in our state.
I like that idea, Brian. That's done. I like it.
Well, thank you. The second thing I had is I want to thank you for standing up the federal medical facility close to Dobbins Air Force Base. As you all know, we had many passengers from the Grand Princess in Georgia, almost 500. They were from all over the country. We were glad to work with you all to support our neighbors from other states, including 31 Georgians.
Thank you.
We're down to about 200 people there right now. We have got things working very well there. But I want to encourage you, when those visitors leave, I would like for you to consider leaving that facility stood up to help us with the surge that we're seeing in our, especially at Metro Atlanta area hospitals. So just want to keep that on the table if you're willing to consider that.
Okay.
And then the third thing, and I will pass this along to you, this is just a kind of a big idea, if you will, as the stimulus packages continue to move through the Congress. We created an economic impact subcommittee of my coronavirus task force. They had a recommendation, and we just got this not too long ago, but we've been vetting it all morning. But one idea to help the states in these struggling revenue environments that is unlike the recession when things went down slowly, we states had time to prepare. At the end of the year, we're all facing drastic revenue drops. And the idea of a block grant to the states to help fill revenue shortfalls would be something I'd like for you to consider. And also we had an idea on the unemployment insurance. But I'll get that to you all for considerations. I just wanted to get that on the radar, and we'll talk to our congressional delegation as well. I know you have a lot of things to consider, and we just wanted to throw that out there. But thanks again for the constant communication and support.
Thank you. Very good. Thank you very much. And we will consider everything you've said. Thank you very much. Okay. Who's next? Next governor, please.
Hey, this is Phil Murphy.
You're looking well, Phil. You're looking well.
Mr. President, so are you. Good to see you, the Vice President. Thank you for everything.
Thank you.
Just a couple quick points. We've had a really good week with FEMA, so I want to give them a shout out. FEMA Region 2 is helping us set up testing. The Army Corps is actually visiting us in this building at 4 o'clock today to talk about repurposing facilities for more beds. So thank you for that.
Yep.
We've had conversations with the VA in terms of backup medical support. 2 areas. One, just in terms of where we're going to need some help. One is to underscore Governor Kemp's point on flexible block grants.
Okay.
Those will be important to us to allow us to continue to serve our people. And secondly, the Lord helps those that help themselves. I promise you, we're doing everything we can to get PPE. We're acquiring it. We're getting donations, but we still are going to need a big slug out of the strategic stockpile. So for all the above, many, many thanks.
And so, Phil, try what you can, do the best you can to get what you can actually get. And we're also having a lot of things produced that, frankly, nobody's ever seen anything like this before.
Okay, you are listening live to a press conference from the president. There's President Trump. He is sitting next to Vice President Mike Pence. And it appears they have a screen where they're hearing from governors across the country, talking to them about what's been happening in each individual state and what will be they are requesting in terms of what they need. And so that's going to go on for a while as they continue to just go governor to governor. That is going to do it for our broadcast. The stream is going to continue from Phoenix, Arizona. The folks at Fox 10 Phoenix are going to bring you the latest live pictures and news conferences from across the country. Visit Coronavirus Now.